Understanding about fatty liver and a clear guide from an Ayurvedic doctor. Excessive weight, especially in abdominal area, increase the risk of fatty liver. Fatty liver disease is a common condition nowadays in which high levels of fat get stored in the liver. If left unnoticed, it may affect the normal function of the organ, leading to liver damage. If the component of the fat reaches 5 to 10% of your liver's weight, the condition gets worse over time. Fatty liver disease may be found in two ways: alcohol induced fatty liver disease and non alcoholic fatty liver disease. In general, people are confused about, can Ayurveda cure fatty liver disease? Yes, it's surprising that Ayurveda can reverse the complication of fatty liver naturally. So from this video series, I'm going to take you to a deep dive to comprehensive facts associated with Ayurveda approach to healing fatty liver disease. In Ayurveda, fatty liver is understood as a disorder related to the imbalance of Pitta and Kapha doshas. According to the Ayurvedic principles, an unhealthy diet, sedentary lifestyle, and improper digestion contribute to the accumulation of toxins, armor in your blood. Then these toxins combined with aggravated Pitta and Kapha dosha can lead to the development of fatty liver. People living with fatty liver disease often do not show any signs during the initial stages of this disease. When the condition progresses to cirrhosis of the liver, symptoms may be life-threatening. Let's see what are the common symptoms of fatty liver disease that you can notice for self-diagnosis. Abdominal pain, nausea, loss of appetite or weight loss, yellowish skin or jaundice, swollen abdomen and legs. You feel tiredness, fatigue, mental confusion, enlarged spleen, and red herpes. Fatty liver can be caused by various factors, including lifestyle choices, underlying medical conditions, and genetics. Let's see what are the common causes for fatty liver disease. Poor diet. Consume a diet high in saturated fats, trans fats, refined carbohydrates, and added sugar can contribute to the development of fatty liver. Obesity and metabolic syndrome. Being overweight or obese is significantly associated with fatty liver. Excessive weight, especially around the abdominal area, increases the risk of development of fatty liver. Metabolic syndrome, which include the combination of obesity, high blood pressure, high cholesterol levels, and insulin resistance, also increase the risk of fatty liver. Alcohol consumption. Excessive alcohol consumption is a significant cause for fatty liver. Alcoholic fatty liver disease can occur due to the toxic effect of alcohol in liver cells, leading to fat accumulation and leading to inflammation. Another reason is rapid weight loss. Rapid weight loss or crash dieting can trigger the accumulation of fat in the liver. This is known as acute fatty liver disease of pregnancy in pregnant women or as a starvation-induced fatty liver. Insulin resistance and type 2 diabetes. Here the body cells become less responsive to insulin can lead to development of fatty liver. Moreover, genetic factors. Some people may have a genetic predisposition to develop fatty liver. Certain genetic mutations can affect how the body processes fat and contribute to fat accumulation in the liver. A healthy diet plays a crucial role in managing fatty liver. Let's see how Ayurveda advocates you to reduce fat accumulation in the liver, support liver health, and promote overall well-being. Reduce intake of saturated fats and trans fats. Limit the intake of food rich in saturated and trans fats. This includes fatty meat, full fat dairy products, fried foods, processed food, snacks, butter, sausages, bacon, and cakes. Instead of these, use lean sources of proteins like fish, chicken breast, tofu, beans and legumes, Greek yogurt, these healthy foods and cooking method like grilling, baking, and steaming with using healthier cooking oils like olive oil, canola oil, sunflower oil, sesame oil. Then these oils which has very low saturated fat. Take more plant-based foods. Increase the consumption of fruits, vegetables, whole grains, legumes, and nuts. These foods are rich in fiber and antioxidants, and they take more colorful, pigment-containing foods. And Ayurveda, we recommend papaya is a great food to manage the symptoms of fatty liver disease. Increase fiber intake. Try to have at least 25 to 30 grams of fiber per day. Fiber-rich foods help in digestion, promote satiety, and support the liver health. Limit added sugar and refined carbohydrates. Minimize the consumption of sugary beverages, sweets, chips, refined carbohydrates, and white bread, which is a cause for increase the level of triglyceride in your blood. And also, these foods can contribute to weight gain and worsen the condition of fatty liver. Stay hydrated. Drink adequate amount of water throughout the day to support overall hydration and assess the flushing out the toxins from your body. In my next video, I will discuss some home remedies and a secret Ayurvedic recipe to control fatty liver disease. So stay tuned. Thank you for watching.